To me, the MIM service is a crucial part of perinatal mental health. The picnic was organised so that we had an opportunity to sit with some of our service users, for them to meet other service users with their babies in an informal surrounding.
My MIMS nurse, Petra, told me about this picnic and the opportunity to meet other service users, and also an opportunity to share my story.
The MIMS service makes a massive difference to people, generally speaking, I think, because we work in a very cross-service way, because we have a big role in educating, training, supervising other professionals. Our clinical work is very much with women who have had quite significant issues with their mental health. That impacts on their ability to parent in the way that they want to.
When I was pregnant with my fourth child, I experienced some psychosis. I wasn't feeling well, I felt very isolated, very poorly, had very, very sad thoughts. I contacted the MIMS, or the MIMS teams were contacted by my family, who came to see me and helped me. They kept me safe, they made me feel safe, they talked through a lot of my thoughts with me, gave me lots of coping strategies, and were there right up until my son was about 9 months old.
6 years ago now, when I first came into contact with the MIMS service, I was desperately ill with real severe depression. I have suffered from depression since the age of 19. When me and my husband considered having a baby, I was then in a period of remission, and still after all those years sort of in a period of denial as well, and not wanting to be associated with the illness, and also thinking about the pregnancy and wanting to do the best by my baby and wanting to go natural. And so I came off my medication.
Because we're having to focus on the individual need of the woman and the implications on the baby and the baby's development, the way that we work with them has to be very creative and flexible. We often take the service to them, or they come to us, depending on what they identify as being better for them.
I was put in contact with the MIMS service, and they were there to manage me, help me, support me, advise me, get me the medical care and support systems that I needed. After a long journey, considered having another child, something that we would never have considered had we not known that the MIMS was here. That was not only a service that was in place, but an effective service, a service that could be relied on, that I had full faith in their expertise, knowledge, and also their support and care. Fast forward, I now have a beautiful 5-month-old, another little boy, and I've been well and enjoyed every moment, and Jack, his older brother, loves every moment of Harry, and we are a happy family.
When you're in there, it's very hard to find anything positive at the time, but the more I spoke to my perinatal nurses, the more they understood me and I trusted them, the easier it was to find strategies and just ways to get there. And I was there in plenty of time to have my baby and to look forward to it. And yeah, it was, I didn't think I would get there. I didn't. At about 3 months I started to feel very lost, very worried, and yeah, we turned it around, and I was very excited, looked forward to it a lot, and Oscar appeared and completed our family, and it's just perfect.
We're here for those individuals, and having our network of users that we're pulling together, you know, they're very, very keen to participate.
If you're feeling that you're struggling in any way, then please speak to your GP, and there is so much help out there. And don't sit at home thinking that you're the only mum that's going through problems, that's struggling. There is no such thing as a proper mum, or a perfect mum is just a myth.
It all works out just fine. If you get the right support, it works out just fine.